Welcome everyone, and thank you for attending the December 4th Thursday's Lunch and Learn webinar. If you're on the phone, could you please mute your phone because we're getting an echo. Okay, so remember to hold your questions until the end. We'll accept them by phone and via chat. And I am going to mute all the callers and then unmute later.
All callers are muted and they can unmute themselves.
So I'm going to go ahead and introduce our speaker. Her name is Tori Jones. She is the team lead nurse consultant with the Breast and Cervical Cancer Services, Department of State Health. Department of State Health Services. She will be presenting Breast and Cervical Cancer Treatment Access for the Uninsured Medicaid for Breast and Cervical Cancer. Tori, if you want to go ahead and get started. Tori, make sure to press *6.
Can y'all hear me okay?
Yes, I can hear you.
Okay, thank you. Well, good afternoon, everyone. And thank you for having us today to our presentation. We'll be going over the Medicaid for Breast and Cervical program and do a quick overview also of the Breast and Cervical Cancer Services program. So the objectives for today is describe services provided by Breast and Cervical Cancer Services, or BCCS, and Medicaid for Breast and Cervical Cancer, MBCC. Identify the BCCS contractors and where clients can apply for MBCC. Explain the MBCC application process. And describe the future of MBCC as it relates to implementation of the Affordable Care Act. So first we're going to start with a little bit about BCCS. So BCCS is kind of a three-pronged program. The majority of what we do is screening and diagnostics. So we offer screening and diagnostic services for low-income, uninsured or underinsured women. So that means women that don't have any form of health insurance that would cover Pap test or mammogram, and then the associated diagnostic testing like biopsies or diagnostic mams, surgical consults if they have an abnormal screening exam. We also offer a small portion for cervical dysplasia treatment and surveillance. So those would be for women who have already had their screening procedure and they've got a biopsy-confirmed diagnosis of cervical dysplasia. We do offer some treatment that would include follow-up Pap tests, cervical conizations, LEAP, and then also there's case management with both the screening and diagnostics and the treatment and surveillance. And then through our program, we also act as the gateway for access to treatment. So for women that are uninsured, do not have any insurance to cover their treatment if they've been diagnosed with a breast or cervical cancer, we act as the gateway for those women to apply for the Medicaid for Breast and Cervical Cancer program. So all of these services have one main goal, and that's to reduce morbidity and mortality from breast and cervical cancer in Texas. We'll go over a little bit of brief history for you now regarding BCCS and both MBCC because they're closely related. So the BCCS program was first authorized in 1990 by the Breast and Cervical Cancer Mortality Prevention Act. The focus was for low-income, uninsured women. It was the first national cancer screening program in the U.S., and it is primarily administered by the CDC, which is the Centers for Disease Control. This act basically gave states the opportunity to apply for grants in order to finance breast and cervical cancer screening exams for low-income and underserved women who are age 18 and over. Proud to say Texas was one of the first states awarded. There was originally a group of 8 states awarded funding from the CDC, and it did originate as a screening-only program. So it did first start off just with cervical Pap testing and screening mammograms. So in 1998, there was kind of an expansion with the Women's Health and Research and Prevention Amendment. This amendment allowed the states to provide referrals for medical treatment and ensure appropriate follow-up and support services through case management. So that essentially allowed programs to then offer diagnostic testing if the screening exams were abnormal. And then Texas did begin providing those services in 1998. Then in 2000, there was further expansion of the Breast and Cervical Cancer Prevention and Treatment Act of 2000. which was essentially Medicaid for breast and cervical cancer. So this is the act that gave states the option to provide treatment through Medicaid for eligible women who were screened and diagnosed through breast and cervical cancer services and found to have a breast or cervical cancer. So in Texas, we do call it Medicaid for Breast and Cervical Cancer, or MBCC. It is available in all 50 states, although each state has a different kind of name for it. It was originally referred to as the Treatment Act, so you may still hear people refer to it that way, or BCCP Medicaid, but it is Medicaid for Breast and Cervical Cancer. The MBCC went to have a further expansion in 2007 with the Human Resources Code 32.024, the Treatment Act expansion, and this allowed states to further extend the eligibility for that program, and we'll talk about that here in a little bit. So those were the federal authorizations that authorized this program. There's also some state authorizations. So Texas Administrative Code 25, Part 1, Chapter 61, and the Title V Maternal and Child Health Services Block Grant authorized by the Social Security Act. This is the Title 25, Part 1 is what allows us to operate breast and cervical cancer services through the Department of State Health Services. And the Title V Maternal Child Health Block Grant allows us to offer those cervical dysplasia treatment and surveillance services because the national program does not allow us to pay for treatment. So we'll go over some general eligibility first for the screening, diagnostics, and then the cervical dysplasia treatment surveillance services. So in order to be eligible, women have to have a gross family income or household income at 200% or below of the federal poverty level. She must be a Texas resident and not eligible for other programs or benefits providing the same services. So in addition to these three general eligibility criteria, there's also some specific clinical eligibility criteria, which we don't have time to go into today, but there's basically specific criteria for both breast and cervical. An example would be cervical screening would start at 21. Breast screening generally starts at age 50. That's our target population. So the eligibility criteria for Medicaid for Breast and Cervical Cancer, or MBCC, in addition to women meeting the general eligibility criteria for BCCS, meaning they have to be 200% or less of FPL, at least age 18, and a Texas resident, there's a few additional requirements required by Medicaid. So they have to have a qualifying diagnosis. They have to be a U.S. citizen or a legal immigrant. They cannot be insured. So this is quite different from the screening and diagnostics, where we are able to enroll women for screening and diagnostics if they have insurance, but they're not able to pay for their premiums or their co-payments. However, with the Medicaid, if they have insurance, they are unfortunately not eligible, even if those premiums are high and they're not able to pay them. They have to have a need for treatment, and they can be screened through BCCS and diagnosed, or they can be screened and diagnosed through a non-BCCS provider. And that portion of it is essentially what the expansion in 2007 allowed. So with the expansion, the options had each state had three different options. The first option being women had to be screened through the national program. The other was the individual screening didn't have to be paid through the national program, but the provider who did the diagnostics would have been within their organization. And the third option is the one that Texas operates under, which is that any provider can do the screening and diagnosis, and then the woman can be referred over for the application process. So MBCC is a payer of last resort, meaning that they cannot be eligible for any other services. So if they have Medicare or different type of Medicaid, they will not be eligible for this specific type of Medicaid. So these are just a few examples of the cervical qualifying diagnoses. These lists are not all inclusive, but these are the ones we see most commonly. You can see there's quite a range. We are able to cover through Medicaid for breast and cervical cancer a couple of precancerous conditions. So for cervical, that's high-grade dysplasia, also known as severe dysplasia or CIN3, and then carcinoma and adenocarcinoma in situ. This is the list for the most commonly qualifying breast cancer diagnoses. Again, we do have a pre-qualifying or qualifying precancerous diagnosis for breast. That'd be ductal carcinoma in situ. Again, this list is not all-inclusive, but these are the ones that we see most commonly. So MBCC does offer full Medicaid for women enrolled, not just coverage for their cancer treatment, which is a great benefit of the program. So they are able to get covered physician and hospital visits, care in a nursing home, speech, physical, or occupational therapy, mental health care, home health. Certain limitations exist for glasses. They do get up to 3 prescriptions per month. Pregnancy and childbirth care if they become pregnant while on the program. And then there is an area within Medicaid where they can get transportation assistance to help them get to their physician, their dentist, or their pharmacy. So essentially they're able to receive all benefits that would be covered under traditional Medicaid. So for people asking if once they're enrolled, if their providers have questions about the different types of services that are covered, when their benefits begin and end, questions about claims, which forms to fill out, or their reimbursement rate, all of that's administered through the Texas Medicaid Healthcare Partnership. We listed their phone number here for providers, and also their website, www.tmhp.com, and there's a link for providers they can click on and go and get information about coverage for their clients who may be on MBCC. Pre-authorization is also something that a lot of folks are not aware exists within MBCC. So they do require pre-authorization for certain procedures that you would for any other type of Medicaid, usually any type, certain types of surgeries and imaging like MRI, and sometimes require pre-authorization. So if any client needs information about MBCC once they're enrolled, if they've got questions about their application status, 211 will be able to look that information up for them. The 877 number is there if the client has a VoIP or cell phone. Sometimes you can't get through just by calling 211, so this is the 877 number. They can also go to yourtexasbenefits.com and complete the registration information, and then here they would be able to view their case information. This is a little bit different than with other Medicaid programs where clients can use this website to apply for services, make changes, request forms and documents. Unfortunately, they're not able to do that yet for MBCC, but they can view their case information and find out their eligibility date, their Medicaid ID number, and that kind of stuff, and also where to get help. So 211 again to verify their application status, if they need to make any changes to their address or phone number, their contact information, if they want to assign someone to be an authorized representative to act on their behalf, they can do that there as well. Once they're enrolled, and they also have questions about coverage, they also contact the Texas Medicaid Healthcare Partnership, help them verify their benefits, find a doctor, clinic, or hospital that is accepting Medicaid, and again, ask for assistance with transportation. So the process for applying for MBCC is multi-pronged. So it starts with the client and the BCCS contractor. So this would be either a woman that's screened and diagnosed through a BCCS contractor, or she may have been diagnosed by a non-BCCS provider and referred in to help with the application. The BCCS contractor will verify that general eligibility criteria. So that would be that she's a Texas resident, that she's under age 65, that she's got a qualifying diagnosis, and her income. They'll also collect supporting documents like the pathology report that's necessary to verify the client has a qualifying diagnosis, and then any documentation to help show citizenship and residency status. So that would be birth certificate, copy of an ID, permanent resident alien card, that sort of thing. Once the contractor receives all that information, then the application is sent to us here at DSHS for nurse review. So myself and another nurse review all the applications that come in. to verify that the diagnosis qualifies and that there's evidence that the client meets the need for active treatment criteria. Once we review it, we like to get those done within 2 business days. If the application is complete, then we then forward that on to the Health and Human Services Commission for the eligibility caseworker. The eligibility caseworker will receive that, the expedited fax line, review to make sure all the documents are there, and then they have integrated systems where they're able to check if the client is currently receiving or eligible for other types of Medicaid, Medicare insurance, and their residency status. Once they review all the necessary documents, they'll make a determination of whether or not the client's eligible. Whether or not the client's eligible, they will notify the client by mail. If they're certified, their initial certification period will be for 5 months. After that, then they will have to renew their coverage. We'll talk about that in a little bit. So how do you apply for MBCC? So the first step, if you're not sure where to go, is to go to our BCCS website. So you would click in bccstexas.com. This page will come up. You will click on Find Local Screening Services, kind of here in the middle of the page. That will take you to another page that looks very much like this one down here, but it'll have this different title. So it'll be DSHS Family and Community Health Service Clinic Locator. You'll click on the clinic locator. It'll take you to a different page. That'll look very much like number 1 with kind of our DSHS logo and the little blue box. Then you'll enter either the zip code and select a mile range, or you can enter the city, but the city will not work with the mile range. So if you want to use the mile range, you'll have to enter a zip code. Once you do that, there's a little drop down. You'll choose Breast and Cervical Cancer Services. Click on Go. And then a map will pop up for you that has a map and a list with the contractor information. So then the client would just be able to call that clinic and let them know that they want to apply for MBCC, and they'll give them the instructions and notify them what documents to bring with them. So again, the client has to be recertified every 6 months once they're enrolled in MBCC. The process is similar to the original eligibility process. The main difference is that the documents don't come back here to us at DSHS. So once their initial review is done, they have to renew every 6 months. So again, the first review comes up 5 months after they're initially enrolled. The subsequent renewals are every 6 months. So the client should receive their renewal document usually within 45 to 60 days prior to the end of their certification period. There'll be 2 different types of forms. The first form will be the renewal application that the client completes. Another form is the treatment verification form. The client will take that form to their treating physician to complete that says, yes, this client is receiving treatment or is in need of treatment. Then both the client and physician submit those completed forms back to the Health and Human Services Commission for the caseworkers to determine their ongoing certification. So HHSC again will receive those documents and then make a final ongoing eligibility determination. So once they receive that, their coverage will end for MBCC once the client meets one of a few things. If she reaches age 65, if she moves out of the state of Texas, if she obtains insurance, which would cover her treatment, or if she's no longer in need of treatment for her cancer. So this is just a little bit of information about the numbers of clients that are enrolled by region. I think this kind of gives you a good snapshot picture of what's kind of going on around the state of Texas. So this is the total numbers for December. So the total enrolled is 4,839. This is kind of a moving target. This is not the, does not include, unfortunately, the number of new applications we'll receive in December. So these are the number of women that were enrolled as of December 1st. And that number will continue to increase as we submit applications throughout the month of December. And this will snapshot of enrollment, percent enrollment by age. Again, this is for the overall state rate. So you can see on average, primarily women age 50 to 64. And this also primarily is women with breast cancer. I would say is 70 to 75% of the applications that we receive. Majority of the cervical applications we receive are for treatment of severe dysplasia or CIN3, which is good because that means they're catching it before it becomes cancerous. And those women will have better outcomes. So the good news with the Affordable Care Act is that we are not expecting any changes to the Medicaid for breast or cervical cancer, even though Texas is not expanding Medicaid under the Affordable Care Act. So the eligibility, the covered services, the application process will all remain the same, which is great news for the women of Texas because that need will still be there for this program. Unfortunately, there are many other states where if they're expanding Medicaid, they're doing away with their MBCC program and having those women get enrolled in the subsequent Medicaid programs they may be eligible for. So we are lucky that we'll still have this available for women in Texas. Open phone lines. Any questions on have? So be happy to answer those.
Okay. I'm going to unmute everyone. Tori, you were breaking up a little bit, just so you know.
All callers are muted. All callers are muted.
Did it say muted or unmuted? Hello, does anyone have any questions?
Yes, my question is only BCCS providers can fill out the MBCC form, correct? Patients cannot fill it out on their own.
Can you make sure you mute your phone if you're not asking a question? Because we're getting an echo. Okay. So can you repeat the question, please?
Yes, my question is only BCCS providers can complete the MBCC application, correct?
That is correct. Only our virtual providers are able to complete that application.
There seems to be an echo.
Yeah. If you could just mute your phone. If you're on the call and you're not asking a question, just mute your phone. And another option is you can type your question and I can read it to her. Okay, let's try that question one more time.
Yes, here in Laredo, Texas, we actually had an individual in another facility completing MBCC application. What would happen to those that you receive? Would you let us know? Because we are BCCS providers, so that those patients don't fall through the cracks.
Would you give us a call after the conference and we'll talk about that?
Okay, thank you.
Tori, do you want me to give out your number?
Yeah, I have that here. So if you need
Okay, fantastic.
here's my phone number and email address and also and the other nurse that primarily works with MBCC. It's like too loud, like I want to cry.
All callers are muted and they can unmute themselves.
So I went ahead and remuted the phone so it wasn't an echo. So if you have a question, just type it and I can read it. And Tori, be sure to unmute yourself, hit *6, and I'll read you the questions. Does that work, Tori? Tori? Tori?
Yes.
Okay, so one of our questions is the coverage only for 5 months?
It's at the initial enrollment, yes. The initial enrollment, the coverage is for 5 months, and then the client will receive their renewal packet. Once they complete that, send that off. The HHSC caseworkers will again determine if they are eligible for ongoing coverage. And that process would repeat itself every 6 months for the duration of their treatment until their treatment is completed.
The next question is, what is the residency requirement? How long does the applicant have to have resided in Texas?
So the residency requirement is just that they're a resident of Texas. There is no requirement for the length of time that they have to live in the state.
Okay, we're receiving a few other questions. If you need to say it.
I'm not too sure if I'm going to ask, since the other lady that had asked a question, I believe the question was, if a patient fills out the information to be in your program and it is sent to you directly, do you then send that out to different contractors?
You know, if we receive an application that we know did not come from our contractor, we'll contact the client or the person who sent us the application and give them the information to go to their nearest contractor so that those other pieces of the eligibility can be determined.
Okay, great.
And then we'll have them, that contractor submit that information to us once they get it.
And we're just waiting on a few more questions. Individuals are typing. Okay, so this is a long one. So you mentioned that breast screening would start at 50. Are you following the USPSTF guidelines or the ACS guidelines recommending the screening starting at 40 years of age? What visa status does an immigrant need to have? If someone has a Medicaid that does not cover treatment, can they drop that Medicaid and get MBCC? And are there any resources for low-income, self-employed women 65 years or older who are not enrolled in Medicare? And those are all listed, Tori, in the chat. I know it's like a couple of questions.
Sure, yeah, I'll kind of just start at the top.
Thank you.
So the overall standard guideline that the program follows is the USPSTF guidelines. However, we did receive some additional funding that we're allowed to screen under our screening and diagnostics portion of our program, women who are 40 to 49. The guidelines, so our target population is women 50 to 64 because those are considered the women most at risk for the USPSTF guidelines. But we are able to screen women 40 to 49. Let's see, the next question.
I think it's the visa status.
We don't verify the visa status. That is something that the Health and Human Services Commission caseworkers verify. Our role is just to ask the client to bring whatever proof and documentation they have that shows they're a legal immigrant here. And then HHSC does that. And there's several different things that they use to determine whether or not their residency status makes them eligible. Okay. And then for low-income women who are self-employed, or did I skip one?
No, I think
who are greater. Yeah, the drop Medicaid.
If someone has a Medicaid that does not cover treatment, can they drop that Medicaid and get MBCC?
Yes, they may be able to, and that will depend on what type of Medicaid they were on prior, and that they have to meet all those other eligibility requirements. And generally, if they are on a different type of Medicaid, they would qualify for MBCC because our income requirements are quite a bit higher than other types of Medicaid. So as long as they meet those age requirements and the income and that they need treatment, most likely they would qualify. And then what they would do is they could apply, and then the eligibility caseworkers, again, would look at that and see what type of Medicaid they're currently on. And if they're eligible, they'll switch them over to MBCC. And unfortunately, I don't know of many resources for women who are older than 65 who have not enrolled in Medicare. We do work closely with the Livestrong Foundation and the American Cancer Society to refer women to their navigation services for women who are not eligible for MBCC.
Okay, next question. How well do applicants cope with the online application? Is there help to complete the forms available?
So the forms for Medicaid for breast and cervical cancer are not available online. They are only in paper form and available through our contractors. If they're going online to that yourtexasbenefits.com, that registration process is pretty easy. They just fill in kind of demographic information, so name, address, phone number, and then they indicate yes that they want to view their pay status, and then they can look at the information. But that's a fairly easy process.
Okay. Would you repeat the information regarding the eligibility for clients unable to pay deductible or co-payments?
Sure. So for clients that need screening and diagnostics, so if they need a screening pap test or a screening mammogram, as long as they meet the eligibility requirements for BCCS, and I'll kind of go back to those here, they may contact a BCCS contractor for their screening and diagnostic services. But if they have insurance that can't pay for their premiums or deductibles, they are not eligible for the Medicaid.
Who is the BCCS provider for Abilene?
For that area, we have a new contractor coming on board, but I'm not sure if they've yet signed their contract, so we can probably send that information out to everyone as soon as I verify that they have an active contract.
Okay.
I passed it, sorry.
Okay. And then
Lower the clicker.
once they have coverage, are they given a listing of providers to go to for treatment? How are they navigated?
Once they're eligible for the Medicaid, they will receive information in the mail, and they could call one of those. There's phone numbers on there where they could call and find out what providers are in their area.
Okay. What documents are needed to establish residency status?
So generally when they're applying for MBCC, most of the time we see that they need a photo ID, so that could be an ID card or a driver's license, a birth certificate, or a permanent resident alien ID card, a visa or a passport is usually what we'll see most of the time.
Okay.
But if you have someone who's not sure what to bring, you can tell them to bring whatever they have, and the contractor will make copies of that, and we'll submit all of that with the application. And if there's something that else is needed, the caseworker will contact the client and let them know any additional documents that they need to submit.
Do they still need to be legal immigrants as of August 1996 in order to apply to MBCC?
That is the cutoff to be eligible. However, there's several different ways that they may not have to have been here in 1996. It could be sooner. Sometimes they can count quarters for their husband, or if they were in the military. So even if you're not sure if they've been in Texas long enough or in the country long enough, we say go ahead and submit those applications, and then the caseworker will verify, because there are several different things that they check to verify that residency.
And then it looks like another, how soon after treatment has been completed does reconstruction need to be done?
That will depend on the client's care plan and what their doctor feels like would be the best course for them. Some women can start immediately after, some women it's several years if they have to do radiation. So that's fairly individualized according to that client's plan of care that they establish with their physician.
Okay. And so just to everyone on the phone and online, we have a bit more time, so if you have any more questions, this will kind of be a last call. And we're accepting questions only by chat because the phone starts to echo. So get those questions in. It'll be in.
We're waiting to see. I'm going to go ahead and switch back to our contact information. And
Yes, that would be awesome. I can include that in the email that I send out. Would that be okay?
Yes, that's okay.
Okay, I will definitely do that.
Well, we wanted to let you know also online that we have had the largest number of attendees for any of our webinars. In fact, we had 120, a little bit over 120 that registered for this. So there's definitely a need for information about the BCCS program.
Another question, can people apply later for reconstructive services? Dory?
Oh, I'm sorry.
Oh, another question, sorry. So can people apply later for reconstructive services?
For reconstruction, Medicaid is fairly specific on eligibility for reconstruction. So one of the requirements for Medicaid, and this is, I understand, not just for the MBCC Medicaid, but for other Medicaids in Texas, is that reconstruction is maybe provided if the woman was eligible for Medicaid at the time she had her mastectomy, or if she was currently enrolled in Medicaid at the time she had her mastectomy. So with the reconstruction piece, it does get a little bit tricky about when they apply for the MBCC and whether or not they've already completed mastectomies or not. One of the questions we often get about reconstruction is whether or not Medicaid will cover surgery on the contralateral breast for symmetry, and it does. If they meet the other eligibility criteria for reconstruction, it will cover the contralateral breast.
Is there any program that assists patients that are not legal residents or that they are still in the process of getting their residency in Texas?
There's very limited resources, unfortunately, in Texas. In South Texas, there is a program called WINGS, which will help women who are not qualified for other programs for treatment, and that one's specifically for breast treatment. Unfortunately, there's not as many options available for cervical. Some of the larger cities do have hospital districts that have programs where they can receive services at a lower cost. But it's quite varied across the state.
Another question, so if a patient was actively on hormone replacement therapy, she will not be eligible later for reconstructive surgery in MBCC?
She most likely would be if she got on MBCC and had her, say she had a mastectomy and chemo and then was placed on hormonal therapy after she completed that. She can remain on MBCC for the duration and completion of hormonal therapy, and most likely it'll be sometime during that time period, which typically is 5 years after diagnosis, that she would be eligible for MBCC and would be able to have reconstruction at that time.
Okay. Does BCCS cover clinical exams for women who think they may have lumps to determine if screening or diagnostic screening is required?
Yes. So if a woman has a lump or a mass or another type of breast symptom, so nipple discharge or changes to the skin, we do provide the office visit for her to have an exam and to see a clinician to verify if she needs any other diagnostic testing or workup.
One of the questions that, this is Lynn Widlowski, the Executive Director for the Breast Health Collaborative. I know there are other organizations that do provide assistance for people that are illegal, that are not legal residents currently. And if you use our breasthealthtexas.org website address, it lists providers throughout the state of Texas. And you can specifically see if any of those organizations are available to assist people that are not legal residents. And if you need that address, it's www.breasthealthtexas.org.
And the slides, as well as the recording of the webinar, will be available on our website, bhtx.org, next week. Cool. Okay, so if we don't have any further questions, we're going to go ahead and conclude the webinar. Thank you so much, Tori. That was an excellent presentation. We really appreciate it. We'd also like to thank our program committee for organizing the webinars. It's chaired by Laura Pena with Harris Health Systems, and the committee members include Gina Lawson with BCCS, as well as Lizette Martinez and Yesenia Mora, also with Harris Health Systems. Our next webinar is going to be January 23rd, 2014. We are still trying to solidify a topic as well as a speaker. So please check our website, bhctx.org, for updates about the next webinar. And thank you everyone for your time and your participation in your